Hello, I'm Nina and this is my TPN and lipid video. So what I'm going to do is I'm going to perform hand hygiene when entering the patient's room, and I'm going to introduce myself, and then I'm going to ask the patient their full name and date of birth, and I'm going to be identifying this, confirming this with their wristband, and then I'm also going to be assessing for allergies. And then I'm going to explain the procedure for administering TPN and lipid per doctor's order. And of course, I'm going to ask the patient if they have any questions for me. Then I'm going to exit the room. I'm going to gather my equipment. So I'll be using an infusion pump extension, and then I'll be using a filter. Then I will have a couple alcohol swabs with a 10 ml normal saline syringe, my TPN bag, as well as my lipid bag. And then also we'll have D10 normal saline available. I'm going to verify the solution and the additives with two nurses to make sure that it's exactly what the doctor has ordered. And then I'm going to assess the lipids for any separation and fat globules and accumulation of froth. And of course, if we see any of that present, then we will discard of this. And like I said, we'll have our D10 available just in case the TPN is done infusing. This will continue before we're able to set up another TPN bag. And then I'm going to go ahead and perform hand hygiene again when I enter the patient's room. I'm going to provide privacy by pulling the curtain. And I'm going to ask the patient if they need to use the restroom before we get started. Then I'm going to don my gloves, and then I'm going to attach the infusion line to my TPN bag. I don't have an IV pole, so I can't hang it. And of course, I'm going to prime the line. And then the TPN will be we'll be using the filter as well. We won't be using a filter for the lipid because of the lipid's viscosity. It can actually clog the filter. And then we want to change the tubing every 24 hours to prevent any infection. And then we want to change the solution every 24 hours to prevent bacterial growth of organisms that will proliferate in like glucose solution. And then we want to assess the patient's central line. Oh, here's the loop. Let's pretend this is his central line. We're going to assess the central line for patency. We're going to unclamp one of the lumen here. We're going to clean it with an alcohol wipe for 10 seconds vigorously, and then let it air dry. And then we're going to attach the 10 ml normal saline, and we're going to pull back, check for blood return. And if we see blood return, we're going to go ahead and flush the lumen. And then we'll go ahead and clamp it again. And of course, we're going to attach the end of the lumen with the prime line of the TPN. Okay. And then I would also clean the second lumen with alcohol swab again, 10 seconds vigorously. And then we're going to attach of course, we're going to flush that again, check for blood return, flush. We're going to need to check for patency of both lines. And then we're going to attach the lipid to the second lumen here. Okay. And then, of course, we want to make sure that these lumens are not used for collecting any blood samples or inserting any other fluids other than TPN. And then I would connect like I said, the lipid tubing below the TPN filter, and I would regulate the lipids and TPN on separate infusion pumps. And then we would have our D10 available just in case the TPN finishes before we hang a second bag of TPN. Okay, and then we will monitor the patient for hyperglycemia, and of course, if they are becoming hyperglycemic, we would want to administer regular insulin according to the prescribed sliding scale. And then we want to observe for complications such as air embolus, again, hyperglycemia, osmotic diuresis, infiltration, or sepsis. And of course, we want to continue to monitor inputs and outputs and document what the patient has taken in the TPN and the lipid. And then also we will document how we left the patient, low bed safety, if they have any other questions. I would undo the curtain and clean up my equipment, make sure the room isn't messy. And yes, that is my skill.